My name is Latonya Wilson. I am 44 years old. I served the United States Army, so I am now a veteran. I'm retired. Since retirement, I have worked part-time sometimes, do a lot of volunteer work, have my own breast cancer foundation. It's nothing like being in the military because I do miss it. But, because of my stage 4 diagnosis, of course, I had to kind of stop. My family, I love them to death. We take trips, especially me, my sister, and the kids and nieces and nephews. We take family trips to make memories, especially when I got diagnosed with metastatic breast cancer. It's like the trips has gotten better. We take trips more often now. We get together more often now. So I just love my family. Anything that I do, they support me with everything that I do. If I don't feel good, they come over and we fellowship. Anything I do, breast cancer walks, just whatever, anything I do, they are right there. He spoke with me and my sister about him coming to stay here in Columbia, South Carolina during COVID because he wanted to maintain employment. So we told him yes. And since he's been here, oh my God, you would think that I had a house full of people. He's very hyper. He does anything that, I need for him to do. If I'm stuck in my room because after treatment, he will come and check on me constantly. He will cook. He will cook for me, take out the trash, take my dog out without me even asking him. He's such a big help. And the jokes, oh my God, he could just tell that when I'm not feeling good, he would just come in the room and sit down with me and just crack jokes. Sometimes I tell him to get out my room, he won't leave. And the jokes just keep going. So it has been such a wonderful blessing having my nephew here. I was diagnosed with breast cancer 3 times. My first diagnosis, I was actually in Bagram, Afghanistan. This was back in September of 2007 when the lump was found. They flew me to Dubai. I went to Dubai and they did an ultrasound. They found that it was a 2-centimeter lump. I convinced them to let me go back to work to Afghanistan. And when I came home in December, I will come back to Dubai, have the surgery, and then go home and recover at home while on my vacation. So they did release me back to work. And when I came back through in December to come and to go home for my vacation, had the lump removed. And I was at home for about 3 weeks. And I'm going to say a week before it was time for me to fly back, they actually emailed me the results that I had breast cancer and the lump was at 2.5 centimeters and it was considered breast cancer. So, of course, I couldn't return back to Afghanistan. My job put me on medical leave and went through 8 sessions of chemotherapy, 36 sessions of radiation. Went back to Afghanistan, September of 2013. My cancer returned and I had my breast removed because it was so small. I didn't have to do chemotherapy or no radiation because it was very small and I had the breast removed. I got right back on a hormonal drug that I was on before, and left Kuwait in 2014 because I needed a break. Went to Houston for a few years, and I ended up going back to Iraq in December 2015. I came home for vacation in April of 2016, and I just felt like something was wrong. I had a little pain in my back, and I had the infamous cough. And when I went to go get checked, and after the results came back, my cancer came back in the lining of my lung. And I couldn't go back overseas. I did fly back for a week to go gather my stuff, and I came right back and went through my treatments. And about a year later, it ended up spreading to my liver. So it's still in my lung and my liver, but it's stable. Everything is stable now. So I've been living with metastatic breast cancer for about 4.5 years, since May 2016. When I was first diagnosed with metastatic breast cancer, it was rough. Even though I was acting hard, no one could see how I really felt. But on the inside, I was a wreck. When I came back from my doctor's appointment, on the day that I found out that I got diagnosed with breast cancer, my mom, my niece, my nephew, they was in the house. They was upset. Of course, that's how they're going to be, because when you think about stage 4 metastatic breast cancer, you thinking that you're going to die in 6 months. That's how it is in South Carolina, where we're from. A lot of people don't live after they've been diagnosed with a stage 4 cancer. So I didn't want to sit there and just be upset and watch my family just watch me like that, and then I'm seeing them being upset. I flew back to Afghanistan, and when I came back, I said, okay, I felt like I had to be hard for everybody, because I know it was hard on my mom's, knowing that her child would have to go through this. So I had to be hard for everybody. So of course I'm still laughing and joking on the outside, but on the inside I felt dead. I was hurt. I was depressed. For a whole year I was depressed. Nobody knew. Even though the results were still being stable at the time, it didn't matter, because I'm seeing other metastatic breast cancer, females not doing too good, not dealing with the way how I was dealing with it. So it still was a mental shock. After about a year, I actually had to go to counseling at the Veterans Hospital. And when I went to counseling, I started feeling better. And when I started meeting other metastatic breast cancer survivors and advocates, and they was talking to me about it, and I started feeling better, like, okay, I'm not by myself. It's easier to talk with people that's going through it than with family and friends that don't really know how you feel, because they thinking that it's going to be okay. But you don't want to hear that from them, because how do they know? So it felt better hearing it from someone that was in my same shoes, especially people that been in the military and they have stage 4 metastatic breast cancer as well, because a lot of us suffer from PTSD, from the military, from going to war, and now it's like we have to fight out another battle. So it feels real good when you get with other people that's going through the same thing. No matter how hard you are, we can still fall, and I fell. So now I am in a better state. I feel much better, but that first year was very rough mentally. I'm telling you, they sent me so much information. It was so much information to where it took me a while to read upon, because it was just so much, and I am grateful for that. When I started going to different conferences, I started learning about the new, about like different treatments, new treatments, and things like that. Like, wow, through all that, even from MetaVivor, just the information I learned from that, going to different websites on the organizations that I know about. And it helped me out a lot, just a better understanding of it, and how to cope, and how to deal with things, on how to meditate, on how to sit back sometimes, to where you don't have to fake it every day. You need time out for yourself, to where even you just sit at home and cry just for a day, and the next day you get back up fighting. We always need that time. I'm going to use my community for instance. When something happens or someone gets diagnosed with cancer or anything, back in the day, used to keep it to themselves. So how are we supposed to know, or the next person supposed to know, if we keep it to ourselves? So I think it's important for me to share my story, because you have other people that's out there that's going through the same thing, and they don't know who to turn to, who to talk to. So when they hear my story, or anybody else's story that's going through MBC, sometimes it can make them feel better, or they can understand that I'm not going through it by myself. Because sometimes we can feel like we're going through by ourselves, or sometimes we can feel that we're the only ones that's going through this. And it gives them a sense of, wow, they going through the same thing. Or that's how I felt. Okay, it's okay to feel like this. It's okay to do this. It's okay to do that. Oh, it's okay for me to cut people off if they don't mean me any good. So I tell my story just to let people know how I feel with MBC, the good, the bad, and the ugly. You can still have fun with MBC. You can still find love with MBC. You don't have to settle just because you have MBC. You have a lot of people that has MBC and think that they just have to settle because they want somebody to love them, but you don't have to settle. You are still a woman. You are still a human being. Don't just let people treat you a certain way because of MBC. And I put all that out, even with me being breastless. If you get breast, get it for yourself. Don't get it for nobody else. I just tell my story because you have some other females that's out there that is struggling with different things every day. And it's to let them see that you're not the only one, you're not by yourself, and it's okay. I love to cook. I might not cook. I might not cook as much as I used to, but I still love to cook. If I find different recipes and things like that, I love to try them out. Sometimes it might not come out the way how I want it to, but I'm still trying it, still trying different recipes. As far as working out, I still love to work out. I don't do it as much as I used to, but I still walk. I try to run. Sometimes I can't run like how I used to, but I still get some running in. Ab work, leg work, I still try to keep that up to where I can still keep my body, a little bit in shape, and just health-wise, period. And I love helping people. Love helping people, especially my breasties. If they having a bad day, they need me to come to them. I'm gonna get my car and I'm going to them. If they need me to take them to the store, I'm gonna get my car and I'm going to them. If they need a ride to their appointment, I'm gonna get my car and I'm gonna take them. It's one breastie now that's in our support group. We talked her into going to the cancer treatment center, and she can't drive that far. So I tell her, don't worry about it, ride with me. And she's been riding with me now for the past 4 times. But ever since her first appointment to yesterday, she's been riding with me, and we have a good time in the car. We laugh, we joke. I'm a jokester, and it's fun because it's like, wow, I'm helping somebody, but helping somebody to go get better treatments, but we having fun at the same time. And she supports me and I support her. So, those are things that I love to do, just helping people, regardless of what you're going through. It's like I get to help somebody that's in the same shoes as me because I've been through it for a longer period of time. So now I get to come back and show her everything that I've been through and to show her where she can go as well. So I love to cook, I love to work out, and I love helping people. In the evening time, when I'm taking off my makeup and my wig, because chemotherapy depends on what type that you're on. Sometimes it can have your skin looking a little crazy. So I do wear makeup sometimes, not all the time, but sometimes. And I do wear a wig because my hair came out. So while I'm taking off my wig and taking off my makeup, I'm looking in the mirror, and sometimes you just look like, this is not what I thought my life was going to be. Even though I know people wear wigs regardless if they have hair or not, but this right here is not my choice. If I had a choice, it would have been different, but this is not my choice. And of course, you wanna hide your flaws, because people are mean. And you wanna hide your flaws, and you wanna feel like a female. You wanna feel like a woman. So of course, you do the makeup, you do the wigs, and you do things that make you feel like a woman. And so of course, those are the challenges as looking at myself after I take the wig off, after I take the makeup off. And I'm just looking at myself like, wow. Even though I still sound beautiful, but it's still an insecurity sometimes, because I never thought my life would end up having metastatic breast cancer and with everything that comes with it, which is not a bad thing. I'm not saying it's a bad thing, but it's a big life change from what you're used to what you have to do now. People don't realize that you actually have people living with metastatic breast cancer. People always praise the survivors, which I have nothing against that. The people that's in remission and they are survivors. We get that all the time. But people don't see that you have people living with metastatic breast cancer. Not because when you think of metastatic breast cancer, they think that you're in hospice, you're in the bed, you about to die. That's what people think about metastatic breast cancer. But they don't understand that you have people that are still surviving, but we are metastatic breast cancer, and we've been living with this, with metastatic breast cancer, and it's a daily challenge every day. So that's why I want society to see, and for people to see that, hey, it's not just survivors that's out here too. You have METAvivors that's out here too, meaning that we're going through treatments for the rest of our life, some form of treatment for the rest of our life, whether it's people that's in NED and they're just doing maintenance treatment, that's still treatment for the rest of their life. And it's still a scary thing because the diagnosis not going to change because you're in NED. You still metastatic breast cancer, but you might just be in NED. Even with stable, things can still change. So that's what I want people to see and to understand. You have people that's around here walking, living amongst you, that's dealing with metastatic breast cancer, that's dealing with metastatic breast cancer. We still living. So, you know, when they think about Breast Cancer Awareness Month, let's start thinking about the METAvivors as well. We might not per se be called survivors, but I still call myself a survivor because I'm still surviving. So that's why I want people to know about MBC. You have people that's living with metastatic breast cancer. It's not always about the pink. Let's think about MBC as well. Well, we don't get together like how we used to because of COVID, you know, especially myself, I have to be careful. Being metastatic breast cancer, you just have to be careful. Being metastatic breast cancer, we are at risk for a lot of things. So, you know, I try to stay away from a lot of places. People want me to go here and go there. I don't go. Do I want to go? Yes, I do. I miss socializing. I miss doing this. I miss doing that. But health-wise, I have to be careful. So it has impacted my family a lot on that because we can't get there like how we used to. It taught me a lot about just actually spending time to myself and spending time with the people that really, really matters, and just, you know, just concentrate a little bit more on myself. And that's what I did for the past few months. I concentrate more on myself, got more rest, organized my house, and just got back to Latonya. Because of COVID, me and the support group, we don't get together like how we used to. We're trying every once in a while. We were trying to find a way to where we'll get together at one person's house, or we'll be in the garage, have the garage up, and we have the table separated, and we still try to keep it, you know, social distancing. We will do that. We tried that, but it has impacted us a lot because we were so used to getting together and talking about our treatments, talking about how we felt, how can we cope, and we give each other advice just on everything. You know, if you're in a relationship, how to deal with the cancer, you know, or let each other know, look, because you going through it, your husband, your wife, your significant other, your family's going through it too. So they might feel some type of way. So don't just think it's always about us, because we going through it, they feeling it too. They might not go through it physically, but mentally, emotionally, they can feel some type of way too, you know. So we don't have that support like that, like how we had when we get together. But now we start to do Zoom calls. So the Zoom calls is okay. It's not the same, but it's okay. We're gonna try it out again in a month to see how we all can get together again, because we miss the scene. We miss seeing each other. We miss being around each other. We used to seeing each other at least once a month, get together, and we look forward to that. So we save all our questions, all of what we going through, and we come, girl, let me tell you what, on this day, this is what I did. Y'all wasn't nowhere to be found. Hey, this is what I went through, you know. And it's fun. It's fun. It's funny, and we just get to help each other out through everything. So it impacted us a lot, but we are trying to work through it. Where I'm at now is much better, but I don't think that we are treated fairly in the medical field. One place that I was going to, I used to always ask about what my blood work looks like. What's this? Oh, everything is fine. Everything is fine. come to find out everything wasn't fine. It was spreading. That's how it spread to my liver. Keep me on the same treatment. And one day something just said, go to the treatment center. And then when I went there, when I found out that it spread to my liver, it was only in my lung and spread to my liver. Because I felt that he didn't care. When they used to send me for blood work, or I had an appointment for blood work, had an appointment for scans, not scans, but x-rays for my chest. When I used to go to these places, the orders wasn't in. Never was in. And I would have to go back to his office. I'm crying because it's like, you don't care. You supposed to put these orders in for me. I'm metastatic breast cancer. It's like you don't care. You just trying to get me in and out. Then another place, matter of fact, I was actually sitting in the waiting room, and another lady, an older Caucasian lady, was talking to me, and she was saying, oh yeah, they offered the breast cancer manager, oh yeah, they called me so like I diagnosed with breast cancer, tell me about different resources and things like that. And I'm like, my first time I got breast cancer, I didn't get that. I didn't get none of that. No breast manager called me. It's like we have to seek out our own resources or seek out our own help, financial help, if that's what we need. But they were giving it to them. It was given to them from the beginning. So I just think that, yeah, we're not treated fairly. I don't know if they think that we just don't understand, or, oh well, I don't know. But I just think that regardless of what your nationality is, what your race is, if you're in that medical field, you're supposed to treat everybody the same. But we're still not being treated fairly. But where I'm at now, I feel that I am being treated fairly where I'm at now. I'm not saying it's bad on everybody, but I know on the African American community it's very bad. If you don't know and you're not educated, then it's like you're gonna be treated like whatever. But when you have people on your side that can tell you this, and you take control of your own medical, then it's kind of like tell them what to do. That's why I tell the community, you have to get educated on your own medical. So that way, if you feel you're not being treated fairly, you can tell them, I need this scan, or I need this done, or I need to go to a clinical trial. And if they're not doing it, go somewhere else. But some people can't afford to go other places. So if you can't afford to go other places, then it's like you have to make sure you're educated enough, and you got to tell that doctor what to do because you're paying him, and this is your life. So that's why I get so passionate about my community, and I get mad at my community too, because it's like you have to learn. You have to learn. The information's out there. Learn about your own diagnosis. I talk to some African Americans, what type of breast cancer you have? Breast cancer? No. What type of breast cancer that you have? So the doctor giving you your paperwork and you're not looking at it, the doctor giving you all the paperwork and your pathology report. You're not even looking to see what type of breast cancer that you have. You have to learn your own stuff. And sometimes you take control of your own medical. And if you can't afford to go nowhere else, then you need to tell this doctor how to handle you. It's important for me to share my story as an African-American woman. Sometimes we don't take our health important because we concentrate on our kids, our family, and everybody else except for ourselves. If we feel a pain, we will ignore it because we figure we can't take off work, because if we take off work, there's money out of our pocket, but I got to feed little Johnny over here. We take care of everybody else before ourselves. We catch a cold, we'll just take something over the counter or a home remedy and keep it moving. And might have a cough for about a month and don't think nothing of it. Just keep taking the home remedy because why? We're too scared to take off work. We're too scared to do this because we have bills and we have a family to provide. That's why I make it my business to tell my story and let them know it's okay to take time out for yourself to go get checked. That job is still going to be there. Your husband, your significant other, those kids is going to be all right if you miss a day from work to go get checked for something. It's okay because you could be taking care of them, but you want to remain to take care of them. So that means you have to stay healthy. If you're not good, they're not going to be good. That's why as an African-American woman, I make it my business to let them know anything can happen to us. I thought I was immune to anything because I worked out, I ate healthy, I did this, I did that, didn't eat no sweets, drank nothing but water. That don't mean anything. I still didn't get breast cancer. So to let them know that we are not immune to nothing. We can still get cancer. We're not immune to anything, but we thinking that, we are immune to a lot of things, or because it doesn't run in our family, it don't run in my family. I got breast cancer. And then you have some females that think that, hey, I don't want to know. But that's not right, because if you don't know and something happened, you walk around here, now you down the inside because you too scared to go find out and you too scared to get treatments. That's not fair to your family. It's not fair to your children. It's not fair to your significant others, because you being scared, but the things can be fixable, it can be fixable. I am a fighter. Like I tell people, I used to fight with my hands back in the day. Now I fight for my life and fight for my health and fight for other people that's going through MBC that's not being treated fairly.